First of all, how do you test for Lyme disease, since many of the tests are not very sensitive? Also, how do you treat Lyme? And Dr. McCarter, if you want to start with that, that would be great.
Sure. So yes, a lot of the patients come to us, they're immune suppressed. So they have a lot of false negatives. And as I said in my talk, a lot of it, what we do is we start to get them more stabilized with detox first. And we actually do what's called a whole blood vaccine, where we can take the blood and we actually sterilize it like we do with the auto vaccine. And so if there's any organisms in there like Lyme, we tend to have a lot of success. And we're starting LDI now, which I spoke about, the low dose immunotherapy. Oftentimes we go ahead and just start dosing them and they find a response to that. So that's the thing that's tricky about Lyme. It's very evasive as an organism. So, and the tests are very expensive. So a lot of times we will just go ahead and empirically treat them with our modalities. We are not big fans of antibiotics because unfortunately a lot of people get better on antibiotics with Lyme and then you see them months to years down the road and they have a lot of gut issues. And so we're focusing more on that first and detoxification.
We also treat with ozone therapies and oxidative therapies. We're not against antibiotics in an acute Lyme scenario, but it's the chronic Lyme where they're getting 6 to 12 months of IV Rocephin or other oral heavy antibiotics. We know that ruins their gut microbiome and creates many other problems downstream.
And someone had mentioned about how to use ozone. We start with insufflation first. So we can do, the nose, the ears, rectal, and we do with very small doses. Again, with the EMF patients, you have to do everything very slow. You have to do very small doses, low concentration of gamma. But yeah, patients can eventually, do some of this at home.
Anybody else care to weigh in on Lyme, Dr. Bray or Dr. Lercher?
Yes. Hello. First of all, warm regards from good old Europe, Austria, and to the visionary and delightful community that acts in terms of public health and generational responsibility. Thank you all for performing this nice Congress and for all the listeners of this Congress. Yeah, it's also very important to perform sports, exercise training to force the aerobic capacity, for example. This is a new aspect because sports medicine offers a lot of possibilities and strategies in the sense of a lifestyle change, so that you use nature as your fitness area. For example, we go to the mountains. I'm not only in Vienna, I'm also in Carinthia, where we have very high mountains, and there you find not much technical devices.
One of the questions that came in for you, Dr. Lercher, was how do you suggest to your patients that they moderate or manage EMF signals outside their direct home in their neighborhood, for example, from cell tower satellites, if they are not fortunate enough to jump away to the mountains or the lake or a rural area?
Yeah, unfortunately, now we are observing, especially in the current COVID-19 lockdown phase, where the citizens are locked away from everyday life. Yeah, it's like a prison. And they are upgrading the transmitters, and many smart cells, for example, are installed. And it means that it becomes more and more difficult to escape from this radiation.
To the panel on, somebody proposed a question on the grounding sheets or even any of the grounding products that are now pervade over the internet. Can you discuss the safety of these sheets in combination with dirty electricity filters or dirty electricity in general? There is some talk about grounding sheets plugged in or potentially a dangerous exposure. Have any of your patients had adverse effects from using these earthing products because of contaminated ground currents?
Yes, I can answer that. Can you hear me?
Yes.
Okay, good.
Thank you, Dr. Bray.
Yes, I have had more negative reports than positive. By and large, I'm not a proponent of that kind of technology. I would prefer people going outside, put their feet in the lake, on the grass. and try to ground everything in the home. So I really think that, some people say it's wonderful and it works for them, but more people I've seen report negative effects. So I don't really, I don't encourage people to buy those sheets, to use
Yes.
them.
We had some discussion about this yesterday, and I have to say that it's not a secret that my wife is EHS, and we had been grounding naively before really doing the research. And ultimately, I, as a neurosurgeon and clinician, did an extremely investigative sort of survey of these products. And it turns out that we had IEE electrician assessments of ground currents. And it turns out that, as someone mentioned yesterday, urban environments, residential homes are frequently not even correctly wired to a ground. And the ground that they have is into a dirty grid by and large, which is contaminated with variable speed motors. And so we're strongly recommending against grounding unless you're really in a rural environment. Another fascinating thing that I'll have to mention is one of my colleagues who's a neonatologist who did a neonatal grounding with his babies in the NICU, noted decreased infection rates, decreased colitis, a whole array of things. Well, it turned out that the building they were in was a circa 1960s construction, and they were building a brand new hospital that he happened to be on the board for. And it turns out that he and I had this extensive discussion about the negative effects of grounding. Well, lo and behold, his original hospital had a true, it may be called a cathode, but it's buried hundreds of feet under the ground. And so it is indeed a true ground and away from ground currents. And so those babies that exhibited the positive effects of grounding were indeed grounded into a true ground. And so only because he was on the board of construction for the new hospital did his IEE engineer electrician put into the plans to make the true ground.
Fantastic.
So just so we
What a
clarify
great story.
Dr. McCarter, somebody sent in a question. What is an organic rotary yeast-free diet, and who runs a solvent profile through what lab and modality?
The solvent profiles we typically do through Great Plains or Genova. Both of those labs did a pretty good job. And for organic yeast-free diet, that gets complicated, but basically it's almost like a paleo diet, meats and nuts and veggies and very little fruits, mainly the low glycemic fruits, and then the combinations. We talk to patients about combining, because they're, combining a fruit with a lot of different foods, they're going to have putrefaction. They already have a lot of dysbiosis. So yeah, we also go by our skin testing, because we find, just even basic foods that they're eating organically tend to be something they're very allergic to. So they're creating inflammation. And so that's one of the nice things about our skin testing is, even if they can't take the antigens, and we have kids that don't want to do shots, we can identify these different food groups. And then also people are really into the keto diets, and these patients, some of them do okay with that, but we have found that a lot of people, I kind of start calling them more of a paleo diet, because when you choose all these fats, their liver is already typically very overloaded. Yeah. So you bring all these fats into their diet and they actually feel worse. So I am a big fan of the keto diet, but I feel like we have to be careful with these patients, because they're just so overloaded.
The other thing is, I think Genova, as of this past year during the COVID epidemic, I don't believe they're offering a solvent test anymore. It used to be called the Toxic Core. I think that's unavailable at this point. So I think it's only through Great Plains Lab.
Okay.
In addition to these facts, I have to say something very important, which is not very common in medicine. For example, the quality of nutrition. We in Austria, we have really a high quality nutrition, and therefore I say it's primarily the quality, which means sustainably produced. This is very important, freshly harvested and carefully prepared. And I see it also in my daily job. For example, many intolerances or allergies can be handled by providing the patient with high quality food. For example, if there's an allergy against apples or with other fruits or whatever, if you take the same piece of fruit or piece of fruit in high quality, you don't see any more intolerance or allergy.
Are there toxic metals or substances in silicone implants other than the silicone itself?
Yes.
Yes.
Oh, is there? Oh, tell me.
Let's talk about that then.
Go ahead.
Dr. Bray, you want to talk about it?
No, you talk about it. Go for
Sure. Yeah, we've got hexane, you've got toluene, you've got all these solvents in your, and even when they say I've had a saline implant, or now the big thing is the gummies, they have lots of silicone and hexane. There's aluminum, there's metals, and there's a really good website called breastimplantillness.com, and they list all the different solvents and metals and things that are in these breast implants. I think even in the gummies, in the new gummies, there's arsenic listed. So yeah, when we see this is very important to encourage these patients to get these implants out and not just replace it with saline.
Yeah, the saline is still encased in a silicone, ball. So
Right.
it's still silicone, even if the inside is saline, and even if it ruptures and saline gets released, you're still getting exposed to those types of toxins.
And I also believe there's a report about a recent implant causing lymphoma, I believe. And so many women are taking out those implants on the lymphoma risk too. Another question that no one submitted that I'll submit that I think is fascinating since you mentioned it. Now with the increasing availability of marijuana edibles, CBD products, et cetera, it's basically exploded in so many states where it has been recently legalized. How are you as clinicians dealing with the utilization of CBD, medical marijuana, as I'm sure many of the patients that come in are at their wits' end for therapy? In my own practice in neurosurgery, I have many pain patients who are utilizers of marijuana products.
Unfortunately, in Texas, it's not approved yet. So you can use CBD, and it's obviously got to have less than 3% THC. We don't use it a lot.
Dr. Bray or Dr.
Yeah,
Laird?
we use it quite a bit.
Okay.
With our pain patients, and we have good results. It helps them with sleep. It helps them manage their anxiety, depending on their pain level or anxiety level. We have to. We let the cannabis clinics do the assessments and determine exactly what sort of a ratio is needed. So and yeah, but we find them very useful. We use them a lot. Probably every other person is using some cannabis oil.
I have a question for you, Dr. Bray. So is the types they use have THC tend to be more, you get more results, or do you find it's better to have no THC or just a little?
Oh no, yeah, a little bit is useful. We've found you have to titrate these because our patients are so sensitive. We like a drop or two max, and then they just kind of coast with that for a while, and we just monitor. Of course, we recommend organic. Can't always get organic. Cost is really sometimes prohibitive. It's $100+ a month, and we have socialized medicine. So, we're trying to do things in environmental health that everyone can, access. So I would love to be able to have all the testing that you guys do and all the lovely interventions that you do. But we have to navigate with what we have, a shoestring here and whatever. And so, but Trudeau has allowed medicinal marijuana to be used in Canada. So we're grateful.
Thank you. Since we're on that question of access, yes, Steph, Dr. McCarter and Dr. Seymour are able to order these tests, but unfortunately, many of these tests are not covered by standard insurance protocols. And so I would say that these are more concierge-like or designer medicine clinics, which are extremely useful, but most people through their common insurances don't have access to. So one of the questions that was submitted, could anybody recommend in the mold area, any mold testing for do-it-yourself mold testing? Can patients acquire mold culture tests kits to test their homes, cars to send to the lab. Also any self-testing where patients really can't afford the more expensive, laboratory assessments, and that's open to the panel.
So
If
we're
you
not a
have-
big fan of mold plates because there's spores, but there's also a lot of mold and mycotoxins that get in dust. So I know the companies are more expensive, but like Real Time Labs does a great test. They do mycotoxins and you get dust. You take not just, what's coming from the air. Those are always not a very good test. So Envirobiomics does a kit that's not quite as expensive. So they do the ERMI and the HERTSMI tests. So we recommend that. That's something that patients can do. And I believe Dr. Dennis had presented at one of the conferences that you can sometimes call Envirobiomics and they'll send plates and patients can put the plates on their clothes and kind of tap their clothes and see if anything comes back. Because a lot of people will get out of a moldy house and still wonder if, do I still have mold? And so that's something they can try as well.
Yeah, and through Real-Time Lab, specifically for mycotoxin testing, it's called an EMMA test, like a little girl's name, EMMA.
Okay, thank you.
Here in Austria, we have special labs who come into the house for detection of this, of the type of the mold. And then we consider always a professional renovation.
In Canada, we have building biologists that can come to the home and take samples as necessary. They know what they're doing. So, but do it yourself. The good old sniff test, if you can smell mustiness in the house. And then in our health history and environmental history, as all of you know, you're always asking about water leaks and floods and basements. Basements are notorious in Canada. Everyone has a basement, right? Because, we have to keep warm and we have somewhere to live other than the surface of the earth when it gets so cold. It's a big problem here in Canada, but do it yourself. It's just really basic stuff.
Yeah.
Thank you.
I agree.
I think something up front and urgent here is for those people that have electrohypersensitivity disorder or any other potential environmental illness. What are your thoughts regarding COVID vaccination? And again, that's open to the panel. Dr. Bray, if you want to start, or if you need more time to think about it.
No, it's okay. For EHS, well, a lot of our EHS patients also have MCS, and they also have chronic fatigue syndromes, and fibromyalgia, and their immune systems are delicate. So I would say yes, they should get vaccinated, but and it's hard right now because of the scarcity of vaccine access, but if they can do a little bit at a time, wait a month to have a quarter of a dose, wait a month, another quarter, that's what we recommend. But is that going to happen? Probably not. So I don't know, Dr. McCarthy and Dr. Seymour, if you guys, what's your thought on that?
We basically know that, just like you said, most of these EI patients, EMF patients have some form of a chemical sensitivity to, and they're essentially allergic or sensitive to many of the ingredients. So we're just going based off the CDC's recommendation.
Yeah.
You can Google it and look on their website, and it says if you have a PEG or a polysorbate allergy, it's not recommended that you get the vaccine. So obviously if there's an allergy component, then we would urge precaution.
Anybody else?
Yeah, they are the same rules and the same procedures as for every other vaccination. I say, yeah, and then it depends on the type of vaccination, because we don't have only the genetic modified. Now there are also COVID-19 vaccination produced in the ancient way or traditional way, with viruses extracted from animals, for example, not genetically modified.
Yeah, their immune system is not well regulated, so it's kind of a touchy subject. Yeah.
Okay, from a critical disability studies perspective, there are significant ethical questions around the use of provocation testing for those suffering from electromagnetic illness. That is, making these persons feel worse via provocation in order to prove or legitimize their condition. How are these questions best dealt with from a medical or medical ethics perspective?
The room we use is 0, 5, and 10 hertz.
Up to 60
Up
too.
to 60, which 60 is the electrical outlets. So a person's already exposed to that anyway. So, you know, it's
We're not giving them exposure to like the level of a smart meter. We don't have that. But
Are
we
you
know they're
ever-
getting exposed to it in Dallas, Texas.
And what are you measuring? I'm just curious, what are you measuring? Heart rate variability or?
We
Or
do
just-
heart rate variability, but we're measuring their blood pressure, their pulse, and then we have them do a cognition test to see if it's affecting their cognition. Those are the vital signs essentially that we're checking when we admit the frequency to them.
And is it equivalent to what appliance would you say if you had to give me an equivalent to, would it be equivalent to a cell phone being close to them or equivalent to?
No, it's a
electrical outlet. So anything you plug in
Oh,
an
it's interesting.
electrical outlet,
Oh.
yeah. Because
Oh.
most of our patients are very sensitive to just basic 60 hertz.
Okay.
Yeah.
So it's not really earth shatteringly bad. It
Yeah,
just,
and we're not letting them turn their phone on and bring it in the office, or I mean, that's
okay.
not allowed in here.
So it's very gentle. It's sort of a little gentle controlled thing. Yeah, the issue is that in Canada, for our MCS patients, they do a certain hospital, which shall remain nameless, does provocation challenges on our patients, and it just snows our poor patients, and they get distressed, and they end up getting PTSD, and then we're left for years picking up the pieces because it's like an assault, you know, when they had visited this allergist or allergists, and it's very traumatic. So from an ethical standpoint, you know, all these provocation tests, I understand you're doing it very carefully. You know, we always kind of perk up our ears and try to make sure our patients are going to be all right. The poor things.
Yeah, sometimes they even react to 5 and 10 hertz, and we know that those can be beneficial frequencies too. So it's interesting.
Okay, thank you.
Are there any tips for distinguishing EMF illness from chronic fatigue syndrome or myalgic encephalomyelitis? Somebody also mentioned POTS, postural orthostatic tachycardic syndrome, and also dysautonomia, Lyme chronic disease, Epstein-Barr, multiple sclerosis. Since so many of these symptoms overlap, do any of you have sort of a protocol that you can follow to really drill down, yes, this person has EMF illness and not these concomitant issues?
A lot of it comes from clinical history.
Mhm.
I mean, you don't have to do, so most of the patients that have come and seen us have hundreds of thousands of dollars of lab testing, including, you know, IGeneX Lyme testing and Epstein-Barr titers, and, you know, been treated with antibiotics and steroids and all kinds of medications, and seen multiple specialists. And that's why I say the history really gives it away. If I have a patient that comes in and says, every time I put my cell phone up to my ear, my heart races, and they said I have anxiety, and I go to the ER, and, you know, my EKG looks fine, and they give me a Xanax, and here I am. You know, they're going to tell you. We've had patients say, I cannot walk by a refrigerator. I cannot go in my laundry room when my washer is on. I cannot use my cell phone. People can sit in our testing room and say, somebody's got a cell phone on in there. And we have to go in there and say, hey, patient, did you make sure that you turned off your phone completely? Because our patients react to that just as much as they would react to chemical smells if someone was wearing a perfume.
And that's like what Bill Ray taught us, is that as soon as you teach these patients to avoid these things, their symptoms get better. But they aren't being educated on that with their doctors. So once they start cleaning up their home or finding a way to avoid these things, they start feeling better.
It's so important to take these EMF histories. I know even in my own practice, I'll see patients who are referred to me for neurosurgical disorders where the imaging is mild, and I come to find out that they have a Wi-Fi router by their head or a smart meter on the outside of their wall. And I'm just, I'm hoping that all of you as clinicians have people who are studying with you to be enlightened on how to assess these patients comprehensively.
Unfortunately, many of these patients are sent to a psychiatric treatment, unfortunately. And then it's the fact that there are two types of medical doctors. We have on the one side, the visionary ones like you all, but on the other side, we have many medical doctors who are talking about telemedicine and they're using these devices for or apps, for example, for COVID-19 tracing and so, and they want to have all this. Therefore, it's a very difficult situation that we have two parts of medical doctors, and who is the stronger one?
Dr. Bray, how are you in the education component, and what's your feeling about this?
Well, because we work at the university, we've had lots of medical students and residents and fellowships that we've offered. And so we've had about 8 or 9 fellows who have graduated from our program. It's been a very rich experience for them. It's environmental health still needs to be part of the medical curriculum. We would love to be able to weave that through in every single discipline of medicine. Unfortunately, with COVID, it's a bit difficult. A lot of us are working virtually at the moment, and our students, it's a bit hard at the moment. I think everyone's kind of lurching, but when COVID is over, we'll get back in the saddle. Yeah, it'll be good.
Somebody floated a question about the mechanism of cerebral hypoperfusion. And I know that Dr. Lercher commented on that. Do any of you have a comment on the mechanism of cerebral hypoperfusion within the context of EHS patients or patients that you're seeing?
Dr. Belpom has done some work on that.
Yeah, exactly. Yeah, he's got everything. Yeah, in his papers. Yeah,
it's interesting because he has found that the decreased flow is in the thalamus, and in my talk we talked a little bit at the end about emotions and amygdala, and so I think that amygdala, that's a whole nother talk, but patients that are more sensitive, they tend to have, I believe his work is probably very significant because they have more emotions. That part of the brain is affected.
I agree. And there's a very good literature on that in the scientific papers recently published.
Right. Okay. Someone wanted to know if it was possible to really decontaminate their home from mold. Is there a way to go about doing that?
I say no, because you find fungi also on cheese, for example, but this is a good, it's not possible to have a home without mold. Yeah, you can only handle it, but it's normal that we have fungi also in our fauna and flora.
We have a lot of patients that spend a lot of money working on remediation, and we understand if you have a multi-$100,000, $1 million home, that if it's contaminated with mold, it's hard to let go of that, and it's a financial blow. So people definitely try to remediate, but that's a lot of where, when they're down here, we're trying to desensitize them so that they can function. We have patients that say, when I open my front door and it's rainy or humid outside, I can smell the mold and then I get affected. Well, that's no way to live. That's no way to function. So that's why we do the allergy testing and the antigens that help desensitize so that they're able to function. But we would never tell them, yeah, go back into a completely mold contaminated home, because they're just going to be a hamster on a wheel. They're constantly getting sick. They're taking all these supplements, they're doing all these treatments, but the problem is the environment. And you have to make sure that you live in a clean environment. That is foundational for our patients.
Yeah.
This is the last question, because I've been informed by my organizing mafia that I have to wrap it up. So I'm going to do that. Here we go. Final question for the panel. What is your awareness and your communication to your patients regarding solar panels, solar energy, and smart meters? Drs. McCarter and Seymour, since you're there, why don't you answer that and we'll go around.
So the solar panels have very high magnetic fields coming from the inverters. They do create a lot of dirty electricity. So that's become an issue. And I know in California, there's a lot of people that are calling because they're having to do solar when they build a home. So there are ways to do the solar. We talked to good biologists like Jeremy Johnson is one of them, because you got to have the inverter away from the house. But we've had patients that are affected by the dirty electricity of the house next door that has the panels. It's a real concern we have, you know, because they're starting to fill up this field with solar panels. And there is a way for the industry, as I understand it, to make it safer. But unfortunately, it's right now not being done.
And in regards to the smart meters, we know that the majority of homes in America are being transitioned to that or already have them. Some electric companies are allowing patients to opt out. So you can always ask your electric company if you have the option to opt out. The frightening thing that I've seen in the last year or two is it's not just your electric meters that are becoming smart meters. Now your water meters are smart meters.
In this in this context, I have a very nice information from an Austrian electric company. They say that they can perform smart metering also with a traditional Ferraris counter. That means that you don't need a digitalization for smart metering. This is a very important message because, in this case, you see, I see the future.
Thank you. Thank you. And Dr. Bray, anything else to add before I end?
I concur with what's been said,
Okay.
and same thing. So thank you.
Okay.